Good morning. My name is Greg Smith. I'd like to welcome you to our conference call this morning. Appreciate your interest in the Florida Health Literacy Grants. This is something that FLC has been doing in partnership through the generous support of the Florida Blue Foundation for, this will be our 10th year. So we're really excited and we very much appreciate Florida Blue support to make this all possible. We're going to be sharing with you a little bit today about health literacy and also about the grant opportunity, as well as the initiative and some of the successes that our local partner organizations have had over the years, and then opening it up for questions at the end. So let's move forward. So this is a quote from the National Patient Safety Foundation, just emphasizing the importance of health literacy. According to some of the research that they've done, they feel that health literacy really is, or literacy, I should say, and health literacy are extremely important when it comes to affecting one's health. You're looking at factors like age, income, employment, education level, racial, ethnic groups. According to them, none of them are more important than literacy skills when it comes to health. We can advance the slide. This is a definition of health literacy put out by the National Center for Education Statistics. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate decisions. So this initiative and the programs that are working in health literacy using a contextualized learning approach really are touching on all these elements, the clinical side, the prevention side, including helping students understand how to make healthy lifestyle choices. And then the piece that is often the most challenging to many of us, accessing and navigating the healthcare system, including learning about health insurance. And this is some data that came from a study, goes back to 2003 now, but it really is the most comprehensive study that looked at both adult literacy and health literacy, the National Assessment of Adult Literacy. And so we wanted to share this with you just to give you some context for what levels, what the ability level is of individuals who are functioning at each of these levels. So students who, or individuals, I should say, this is not students, this is a reflection of the American population. 14% of adults functioning at a below basic health literacy level. So by way of example, that means that these are folks who would have difficulty circling data on a medical appointment form or on a hospital appointment slip. Those who are below basic are at an additional 22% who would have difficulty given two reasons. A person should be tested for a specific disease after reading a pamphlet. So reading a simple pamphlet and understanding that information and then being able to put that into action. So those are the sort of two categories that we're predominantly working with under the Florida Health Literacy Initiative, those who are functioning at the basic and below basic level. And then you can kind of look and see those who are at a higher level, and unfortunately only 12% of the American population are operating at a fully proficient level, according to the NAL study. This is a little bit of a breakdown on the NAL study. So it reflects that key populations that we tend to work with in adult education really do have higher levels of exposure when it comes to this issue. So the first column there is the percent of of students who are below basic as compared to the total population. So those who did not graduate from high school, 51% of the population have below basic health literacy skills. Those who do not speak English, 39% of the population have below health literacy skills, as opposed to 13% in the general population. And you can go down there and just see that there's a number of folks, a number of factors there, older populations as well, that have a greater propensity to have low health literacy skills. People with poor health are more likely to have chronic diseases. These are just a few factors. There's a lot of research out right now that shows really the effects of having low health literacy. And we just pulled a few items for this slide. People with poor health literacy are less likely to get the health care that they need. They have an average of 3 times more prescriptions filled as adults with higher health literacy, more likely to be hospitalized. And there was one research study out of Illinois that showed a strong correlation to life expectancy, so have a shorter lifespan. So I'm going to turn your attention now to our initiative, Florida Health Literacy Initiative, again sponsored by the Florida Blue Foundation. And we're going to be talking with you for the remainder of the time about this initiative and the grant application that's now available. This started 10 years ago, really to help local programs incorporate health education into their curriculum, contextualized learning approach. It provides resources and funding, and we'll be talking a little bit about some of the curriculum resources as well. So the focus of the initiative is to provide grant monies, but also to provide other kinds of support, including instructional resources and opportunities to network with other adult education providers, as well as professional development opportunities offered through FLC and some of our partners. We've thus far awarded 60 grants, and through the great work of local grantee partners, have served more than 18,000 students thus far and counting. We've also, again, through their good work and through some of the partnerships we have at the state level, we've had over 300 community partnerships, and working collaboratively with resources in the community is a focus area for this initiative. These are our current grant recipients who will be wrapping up their year this spring. You can see it's a pretty good cross-section of different kinds of programs. Some of them are community-based nonprofit organizations. We also have school district-based adult education programs, community state college-based programs. In the past, we've had library-based programs too. So we don't have any sort of criteria in terms of quotas. All of the applicants are reviewed by an independent review committee, but it just so happens, and again, we've been doing this for 10 years, that we always have a nice cross-section of different programs, both in terms of the types of organizations as well as the communities that they serve. So with that, I think I'm going to go ahead and turn it over to Heather Surrency. She's the program manager for the initiative. So Heather, can you pick it up from here?
I can. Thank you, Greg. And thank you, everyone, for attending our call today to learn a little bit more about the Florida Health Literacy Initiative and our grant program. So this slide shows you the results from our 2018-2019 year. And these results are pretty consistent over our 10-year history. We see a profound impact on incorporating in health literacy into a curriculum through contextualized instruction. About 71% of the students who were involved in the program from 2018 to 19 improved their health literacy. And we measure this through a pre and post assessment. We have two levels, a beginner assessment as well as an intermediate assessment. And most students improved their scores by about 22%. 100% of our teachers and instructors reported that they felt the students were better prepared to ask questions of their doctor as a result of being involved in the health literacy program. And we saw a significant impact on student behavior as well. Students reported exercising more as a result of being involved in these classes, eating healthier, feeling more comfortable with reading medicine labels or medication labels and understanding what they mean, communicating better with doctors are just a few of the impacts. But we really see a wide range of impacts. We see people sharing this information with their friends, family, and community, which has kind of a secondary teaching application. We see students feeling more confident and skilled when they are communicating with doctors, when they do need to seek out health care, when they're making choices for their families in terms of what to eat or what types of activities to do in the weekend that involve physical activity, stress management, other topics like that. So we're really proud of the organizations that have worked with us in the past. They really have seen significant progress in improving health literacy levels. So we kind of talked a little bit about contextualized instruction. This slide just kind of gives you an idea of what we mean. When we infuse health literacy into an adult education or an ESOL curriculum, we are infusing it and still working on those basic skills that are important for all of our students. Improving English language skills and literacy skills, working on conversational skills, improving numeracy, digital literacy, confidence, critical thinking skills. So we see that students are really excited about health literacy. They see how it applies to their life. And many programs, the majority of our programs support that they think students are more engaged and that they think attendance is positively affected by incorporating health literacy into the curriculum. And kind of a little bit more specifically, family health for many of our students is also a motivating factor. So we kind of talk about, again, how can we affect the health of our community as well as our specific family while we're working on those basic skills. So we do see kids sometimes, being involved in some of the projects. On the right, you can see a community garden. That's been a pretty popular program for a lot of our grantees. So that definitely directly relates to family health. We had students out there who are helping in the garden, helping to water and take care of it, and then learning healthy recipes to use the ingredients that they grow in their garden. Cookbooks are another common activity. We see CPR here, which also can affect family health in terms of people feeling secure what to do in a medical emergency. So we have several different components that we feel makes our program successful that we ask our grantees to incorporate into their programs. One would be project-based learning. So I'm going to pull up our website real quick to give you an example of what I am talking about. Project-based learning is a collaborative approach to teaching and learning in which students are placed in an authentic situation where they can practice their language skills and other skills they've learned in the class in order to meet a project-based goal. We really encourage students to develop a project that allows them to work outside the classroom and impact the health and knowledge of people either in your organization or in your community. And there's been a lot of really creative ways that our grantees have used project-based learning with their students. Give me just a moment and we'll see if we can pull that up. So this is our website, which is floridaliteracy.org, and I clicked on health literacy, which is on the sidebar, and you can see there's a lot of different information that we have available. So right now we're talking about the project-based learning, which is under student projects. We do have a video that you can watch of a lot of the different projects that our students have done, but some of these project-based learning items and pictures are listed here on our website to give you a better idea. So we don't expect applicants to completely know what type of project-based learning opportunity they would like to have in the classroom, because it's really important to speak with instructors and students to get some buy-in on what they're interested in and what their skills are. But making a video, writing a song, doing presentations, organizing a health fair, so many different things that students can do that really help to work on all of their basic skills as well as their confidence, which is so important. So I encourage you after the webinar to come take a look at some of these ideas. We also feel that community partnerships are key. Sometimes instructors feel a little nervous about incorporating health literacy into their curriculum because they don't feel like they're a health professional. And that's definitely not a recommendation. We have curriculums that provide very basic health information because many of our students are really starting with the basics. But there's also many people in the community whose job it is to come into organizations and kind of help with health education and health literacy education. So I would encourage you to think about who in your community or what organization in your community might be a great partner. It could be the health department. It could be, like I said, a nonprofit organization. It could be a university that perhaps has a nursing program or a CNA program. So many different opportunities to partner. So also on our website, we have a list of some of the partners that have been used in the past to kind of give you some ideas of who might work well with your program. Hospitals, doctors' offices, drugstore chains. There's just so many different organizations that would probably love to come and speak with your students and help with some of that more technical information. But I kind of spoke to our curriculum. So this is free and available to you whether you are a grantee of the Florida Health Literacy Initiative or not. We have our Staying Healthy for Beginners, our Staying Healthy, what we kind of now call the Blue Book or the Intermediate Book, as well as Coping with Stress, Women's Health, and Health Careers. So these are all plain language guides that also come with teacher's guides, so you can see right here, to help your tutors and instructors to kind of walk students through the process of health literacy curriculum. So I just mentioned that's probably our primary resources, that Staying Healthy curriculum, and our grantees can request free books for their students. In fact, everybody in this call, if you are teaching adult literacy or ESOL program and you're in the state of Florida, then you are eligible to receive a classroom set of books. Our grantees tend to get a few more books as one of the perks of being involved in the program. We also provide a lot of other instructional resources. Some of those are listed on the website, but I try to regularly develop new curriculums on topics that grantees and students are telling me that they're interested in. We have quarterly networking conference calls where we all get together and kind of talk about programming. We get great creative ideas from all the different grantees of what they've tried, what's worked, what hasn't worked. And then I usually pick a particular resource or topic to kind of spotlight and help people to deliver it to their students. We also have the Florida Literacy Conference in May, and as part of our grant funding, you can use $450 of that grant money to go to the conference. We have a health literacy track that has some presentations by FLC staff as well as workshops and presentations by others in the health literacy community. So it's a great learning opportunity to hear from grantees, to hear from health professionals about how to incorporate health literacy into your curriculum. So we will be awarding at least 14 mini grants of up to $5,000 each for the 2020 year. The requirements are that you are a nonprofit organization or government-based agency that provides adult ESOL, adult literacy, and or family literacy instruction in Florida. And when we mean family literacy, really for our program, the focus is going to be on educating parents and helping parents to work with their students or their children in improving health literacy. So again, there are some programs that do have some age-appropriate health literacy programming for children, but the main focus of this initiative is educating parents or educating adults. Another requirement is that you provide literacy services either via classes, small groups, or even one-on-one tutoring, and that you commit to the basic reporting requirements that we have. So all of our application materials are posted on our website, and I'll take you there. The due date for submitting your application is January 30th. So again, if you go to our website, you can click on Health Literacy Grant Opportunity, and then Applications, and you can see all of the information that you need to apply is located here. We have some guidelines that provide you with a lot of detail about the application process and expectations. We have the actual application. I'm going to click on that real quick.
Yeah, she'll open it for me.
So we're very specific in our application of what we want it to look like. So you need to have these headings in your application, and it will give our review committee a great kind of idea or understanding of what you're trying to do. We also have a checklist of all the materials that you need to submit, as well as a frequently asked questions page with a lot of questions that we've had previously. So this slide gives you an idea of what the application screen looks like for our online application. This just asks for general information about your organization. Then this screen shows you the budget format, which you don't have to use this format, but we recommend that you do, just because it's very clear and it will help guide you through the process. Your budget proposal should include, revenue, project expenses, and if you have in-kind resources, feel free to include those as well. But it's really important for you to be clear on your budget. What is the $5,000 specifically going to go to? And kind of separate that out from the in-kind resources. In the past, sometimes the committee is very unsure about how the money is going to be spent, so they really clearly want to be able to understand that. You also want to make sure that anything that is in your budget is closely tied to the objectives that you have in your narrative. Our committee also tends to look for that. So if they see something in the budget that was not written in the narrative, then that is often a red flag of why it's there. So I kind of showed you the application real quick, but those headings that we would like you to kind of use to communicate the information about your program include just a brief abstract, the history and accomplishments of your organization, a need statement about the need of your particular population or the students that you serve, and your objectives. So please write measurable objectives that are very specific. So that's another area that we sometimes see the review committee asking about. Who are you going to serve? How many people are you going to serve? How will you know when you're successful? So make sure that they are measurable objectives. In the guidelines, I wrote some examples of what we're talking about with measurable objectives. You want to have a pretty detailed project description. Again, you want the committee to be able to understand what you're talking about, what your goals are, and what you want to achieve. If you know who you might collaborate or have partnerships with, even if those aren't developed yet, you can still kind of talk about here's what we're thinking that we want to do, here's who we're going to approach to work with. It's very important that you recognize Florida Blue Foundation, so let us know how you're going to do that. Will it be through press releases or on the website, on your materials, things like that. A brief timeline of just how you're going to implement your project. And then evaluation is not required. We'll talk in just a moment about the evaluation that FLC asks you to do. But for some organizations, they have additional ways they want to evaluate. So feel free to include those if there's any additional tools that you would like to use. So back to the application, I showed you the general information. This is the upload documents section. So the proposal narrative that we just talked about with the budget is limited to 5 pages. And that is double-spaced with margins, sometimes and 12-point size. And then also if you have any supporting documents that you would like to include, perhaps a letter of support, or maybe there was a newspaper article or anything that you have produced, but it can be no more than 2 pages. So if you send me a 10-page document, the review committee will only see those first 2 pages. So I'd rather you pick the pages that you would like included. And they must all be PDF files as well. So I mentioned that we have our own evaluation tools, or we call them our reporting requirements. We ask that you administer pre and post student assessments to a minimum of 40% of your students. This information is really important for us to show Florida Blue the amazing work that we're doing, and that we are significantly impacting the health literacy knowledge of our students. We also have a student survey, which is given at the end of a class. It's a behavioral-based survey, so that's where we ask students, did you improve your eating habits? Did you start a new exercise program? Things like that. We also ask teachers and instructors to fill out a brief survey just to give us feedback on what could be helpful to them. Was the curriculum helpful? Things like that. And then lastly, reports. So we ask for a brief mid-year report about 6 months into the grant, and then an end of the year report where you tell us about your project-based learning activity and other classroom activities that you did, or field trips, and all the great things that were done over the course of the grant cycle. So if you want to see these different documents, they are posted on our website for the 2019-20 cycle. They could change for next year, but it will give you a good idea of what these requirements are. Actually, before we get to questions, I'm just going to go back to the website just so everybody's clear. So if you look under the grant program, under reporting, so that is where the information I was just discussing is located that you can take a look at. So currently, with the pre and post assessment, it can either be given by paper, or we now also have an electronic version. We find, especially for some school districts and colleges, that the online is easier. For some other organizations that don't have access to computers, we do also have a paper version of all those surveys. Okay. So this is time for questions. We are going to unmute everyone, but there's a little bit of a trick to it. So when you are looking at your GoToWebinar panel, you have to actually hit the little telephone in order to be unmuted. So I ask that you only unmute yourself if you're going to make a comment, and then you mute yourself back just so we can minimize any background noise. If you are listening to this webinar on a computer, you have to have a working microphone. If you don't, we won't be able to hear you. So if you're in a situation where you do not have a microphone and you would like to ask a question, you can either type it into the chat, or you can actually call in to the webinar and speak to us over the phone. So I'm going to go ahead and unmute everyone, and we would love to hear your questions or comments. I know we also have some grantees on the line. So if there are any current grantees that would like to just briefly share a little bit of information about how your health literacy grant has impacted your students, we would love to hear from you as well. So again, if you have a question, feel free to type it into the chat, or if you hit that little phone icon, you can unmute yourself to ask a question. So we'll give a few minutes for people to try to do that.
Hello, I do have a question.
Sure.
Is this program targeted to parents only? Because we are a not-for-profit tutoring program and college guidance program, but we do have relationships with parents. I just wanted to know, for marketing purposes, am I just going to target just the parents for this program, or can I incorporate it in my day-to-day tutoring program?
So the focus, as I said in that one slide, the focus really is on parents and adults. So I know that there are some programs where, like you said, there's also interactions or educational programs for parents while children are also being educated. That's fine. We have had programs in the past that have had older teens, 17, 18, late high school. So that can be considered as well if they're getting closer to their adult stage, but this is really focused on adult education and adult ESOL programs. Does that answer your question?
Yeah, about 70% are high school students. I guess what I'm really referring to is that project that you were speaking about, that project-based learning. Would that be for parents, or could that be for my targeted audience for the after-school program?
That would be for parents. So perhaps the adult students could put together a project and present it to or involve children in the project.
Parents.
Kind of as the audience, as the target of the project-based learning activity.
Okay, so I'll reiterate what you said. So the 16, 17, 18-year-old students could put together a project and present it to parents.
Yeah, but if you want, we can talk offline just to make sure that your program fits within. Because like I said, usually it's kind of the older high school, so maybe we can talk a little bit more specifically about what you're doing.
All right, dear. Thank you.
Thanks for the question.
Yep.
Heather?
Yes.
Yes, this is Lucas Katz from Miami-Dade College, a current grantee.
Hi, Lucas. Yeah, you want to tell us a little bit about how your health literacy program has impacted your students?
Sure. Yeah, actually, it just occurred to me maybe about an hour ago. I finished going over some post-test results. We're affiliated with the CASAS organization, so we give the CASAS exam that measures students' reading and listening abilities. And so I'm really happy. We were implementing the health literacy in a level 3 course, which is considered like a high beginning ESOL. And 100% of the students passed the CASAS exam, which again is reading and listening. So I think it might be the first time I've seen that. So I think the health literacy instruction really helped in terms of their reading by using the book, the Staying Healthy book, and then our project is really based on presentations related to different health themes. And again, it's a high beginning class, so they struggled a little bit, but they all overcame their anxiety and were able to speak somewhat fluently about health literacy matters. And I think their research helped with their confidence. So I just wanted to report that this was excellent. I mean, the teacher himself is excellent, and he infuses the instruction perfectly, I think, and everybody was thrilled. So it's been a great mini semester these past 8 weeks.
Great. Thank you, Lucas, and congratulations.
Yeah,
also on this questions page, you can see up here in the top left, this is a picture from Miami-Dade College. We talk with organizations a lot about using the resources that you have. They have some science labs, so I think every year, if I'm not mistaken, Lucas, you guys do some really interesting kind of science-based health projects with students. So it's really about using whatever resources you have at your disposal, I think.
Yeah, we try. This past session, though, the class was from 6 a.m. to 8:30 a.m. every day. So unfortunately, the lab wasn't open quite that early. But we try. Yeah, we try to work with our resources.
Great. Thank you. Other questions? Okay. Well, if no one else has any other questions or comments, I really appreciate you attending today, and I encourage you, if you have specific questions about your institution or if you're kind of working your way through your application and you have a question, feel free to reach out to me. Email is usually the best way to get a hold of me, but you can also give me a call, and I'd be happy to kind of help you through that process. So thank you so much for attending today.
Thank you, Heather. Thank you.
Thank you.
You're welcome.